Assume everyone is ready from our side of the table.
Just so we all get an understanding of what the licensed midwife can do. This is taken directly from statute so that we all can get kind of grounded on what we're talking about. The license to practice midwifery authorizes the holder, under the supervision of a licensed physician surgeon, which I think is, we just kind of talked about that issue in the prior item, to attend cases of normal childbirth and to provide prenatal, intrapartum, and postpartum care, including family planning care for the mother and immediate care of the newborn. So again, as my colleague has pointed out, that's what essentially the scope of practice is right there. Not exactly the same thing as medicine. It's differentiated because it's set out in statute.
And the board does, as a regulatory body, have a certain responsibility, not for the civil liability aspect of it, but to try to make sure that the law works and can be followed by the people who are licensed and are required to comply with it. It's very difficult if there is a catch-22 to make sure that the public is protected and that the license functions can be performed as the legislature contemplated. So that was really the reason for the language that you see in front of you. It is derived in part from the ACOG position statement and from other states' laws as well.
So for to start out with is for the physician surgeon supervision for the licensed midwives. As you just previously heard, that they basically are not able to comply with that law with the way things have been working out. But they're required to have it in order to practice, and we have come up with what we think might be a solution to that problem, which is physician collaboration. And so we have drafted some draft language that would allow that to happen.
Mr. Hepler, you advise me, please tell me.
Thank you, Madam President. This effort is really the fine work of Ms. Scurry. And what collectively we tried to do was form this in a more collaborative relationship, taking kind of a different spin on it than the traditional supervision requirement.
Is that there are certain legal issues that do not allow this group of individuals to do what they have been trained to do, and one of them is even in the situation of having to have a woman go to the hospital because an emergency has arisen. The hospital may not take the patient in. Dr. Diego?
There is the malpractice and all that and the high liability, and that's where everyone gets stuck, right? But if that were taken away, I wonder if the OBGYNs would still be interested. I mean, I don't know that if you guys have gone off and explored that, because right now they can say very nice things and say, oh, I'd love to, but malpractice, blah, blah, blah. But deep inside, would they? I mean, are we then going to come back and have a different set of problems?
Okay. Dr. Salmonson?
I appreciate Carlos's comment, and that kind of is my thought, which is if we're saying midwifery is not the practice of medicine, and I respect that, then I would think we do not need physician supervision. And I think we should work towards, so that we don't supervise the pharmacist. So why should we supervise the midwife? I think they should have autonomy, and I would push for that.
Would you like for me to make a comment here?
Oh, no, please make a comment.
This comment is colored greatly by personal experience with a total disaster with a midwife who had an informal relationship with a physician in my small town. And they were caring for a patient in a large town. However, when complications did arise, they transported the patient 60 miles.
Your microphone is not in front of you.
They large town to the small town. The baby did badly, and everyone was sued except for the nurse, not even nurse, but the midwife. It's really colored my opinion, so I have to tell you that up front. But I'm extremely concerned because of the informal relationship. Are any of the other allied health professionals in California legally able to obtain prescription drugs? Nurse practitioners, PAs?
Yes.
Yes, both. I'm counsel to the Physician Assistant Committee. They don't call them prescriptions. They do call them drug orders. And with the proper delegation of services agreement between the supervising physician and the PA,
supervising physician.
And
these individuals do not have supervising physicians, correct?
Not in the same sense that a PA
correct.
does.
They do not. Okay. Would nurse midwife training include the same pharmacologic training and skills as a nurse practitioner and/or a PA?
So let's understand the
They're not nurse
question. The
midwives,
question
they're
you're
midwives.
asking, Dr. Bishop, are there other allied professionals who are trained, allowed to receive materials that allow them to do their job appropriately?
No, I'm asking prescription medications in the absence of a physician's prescription.
Are you asking prescriptions? I don't think that,
That's the crux of the matter.
but that's not what's being asked for here.
Well, it is. Because you can, if all of a sudden you say it's within their scope of practice to do anything, then they obviate all the rules that we have in place for prescription drug administration. See, I'm telling you, this nebulous discussion is opening a door to unintended consequences.
Anita?
They should not be utilizing prescription medications in the absence of correct pharmacologic training that's commensurate with other professionals,
Anita?
is my opinion.
Physicians' assistants and nurse practitioners, when they are utilizing drug orders or whatever you like to call them, your prescriptive power, do have a supervising physician, but then they are performing medical tasks. Midwifery is a separate type of practice. It is not a part of medicine. I mean, it's hard to comprehend that, that's the way it's set up in the law, as a separate type. This proposal does not allow unfettered access. It is the authority limited to the practice of midwifery to obtain and administer these particular drugs, immunizing agents, diagnostic tests, and services for which they are, in fact, trained in their 3-year program.
I would argue if you're administering drugs and caring for patients, that's the practice of medicine. I think we're talking a definition here that I don't agree with. Should be subject to the same requirements that all other allied health professionals are subject to. I think we're trying to get around, as Dr. Yanadev said, legislating a law with a kind of a end around.